Okay, so welcome to today's talk. Today I want to talk to you in short about a very interesting remedy. A little underused remedy, but I like to call it as a lifesaver of a remedy. The remedy Antim Ars. I learned this from my guru, Dr. Vijay Vaishnav, from with whom I learned in my college days, and I worked with him. And what I saw is him prescribing Antim Ars in the worst case of asthma, in the worst case of cardiac failures in higher potencies, in 1M, in 10M, with amazing results. So, I want to today talk to you about this remedy, which I am now using very frequently with amazing results. So, first, let's try to understand antimars. Basically, it's a compound, it's a salt, it's an arsenite of antimony, and mainly it is supposed to act on the lungs and the pleura. The main indication of it is excessive breathlessness. Excessive breathlessness. Excessive breathlessness with a clinical pathology of emphysema or asthma. And the main indication is that the cough and breathlessness is aggravated by lying down and aggravated after eating. When you get this and there are no other symptoms, I'm repeating my words, if there are no other symptoms, then think about Antim Ars. The one very important thing which I've seen with Antim Ars is along with the breathlessness, there's a lot of mucus. So idea of Antim tart is that you cannot get the mucus out. You're it's all inside. The idea of Antim Ars is that the mucus it will come out. This is the difference between antimony tart and Antim Ars. The other difference between Antim tart and Antim Ars is Antim tart is thirstless. Antim Ars is very thirsty with the arsenic element. I have used it very nicely in cardiac failures. Patients admitted in hospital, in ICCUs. I have gone there to see them. Due to cardiac failure, they have breathlessness. Last stages, I have used Antim Ars. I have used Antim Ars in high potencies, 1M, 10M. Remarkable results. But there is one important concomitant, and the concomitant is here. There will be a weakness with swelling of the face and inflammation of the eye. When you get this too, Antim Ars will never fail you. It's a very important remedy for myocarditis, remember. This is the concomitant swelling of the face with conjunctivitis, with eye redness. Mainly, I remember a very interesting case where I was called to see a patient in Bombay hospital. Patient, old guy, lot of effusion of the lungs and cardiac failure with breathlessness. And when I asked him about him, I got some very important symptoms. And few important symptoms were that the breathing was especially aggravated on lying. He was old, roughly 80-year-old, with the wheezing, rattling. And by nature, he was a very creative person, innovative person. But last few days, he had just lost. He had lost hope. He had become a little insecure. What is going to happen? So this is interesting because if you open the periodic table, and this is the periodic table, let's have a look. You can see here, these are the different rows. Hydrogen, that is the first row. Lithium, that is the second row. Natrium, which is the third row. Potassium, Kali, that is the fourth row. You can see strontium, which is the fifth row. You can see here baryta, which is the sixth row. Now here, the antimony, okay, interestingly, where is antimony? Antimony is here, just below arsenic. So what you see, Antim Ars here, the main idea of fifth row is the idea of innovation, creativity, and the main idea of Kali or calcarea or arsenic in the fourth row is that of insecurity. So what I saw in this patient was a lot of insecurity about their creativity. You can see here. You can see what is written by Antimony by Shonton. They have written loss of creativity, silence, loss of honor. So they have done too much and now they feel as if lost themselves. So Antim Ars and higher potency, remember, 1M. And he came out of the hospital within 3 days. Remarkable result. This is what I want to tell you, real life experiences. Even in conjunctivitis, I've used Antim Ars with good results. The other interesting concomitant I've used in cases is sciatica. Sciatica with wandering pains. So what are the keynotes which I have seen and I want you to use? Emphysema, asthmatic conditions, with restlessness, with white coating of the tongue, with frequent thirst like arsenic, and cannot lie down. I want to tell you a little bit about the mind state. They will have themes of antimony and arsenic. They will be creative. They want to live in an ideal world. They want to live. They feel everything should be ideal. And when things are not ideal, they feel disappointed. And their main feeling often is, now no one is there. I'm all alone. I was creative. People used to talk so highly about me, and now no one even calls me. ये दुनिया अगर मिल भी जाए तो क्या है? And they also have the other idea about financial insecurity. What will happen? Because previously they were very big. So this antimony arts, where previously they were very creative, now no one is there, no one looks at them, and now they are insecure. This I've seen. I had a very interesting case of interstitial lung disorder, and I had taken his case. Already he was on a constitutional remedy. I think the remedy was calcarea. But he used to get a lot of acute attacks. And the main symptoms were the same in the acute. Cannot lie down, lot of wheezing, constant state of anxiety, white tongue, thirsty after eating, Antim Ars, and magically he came out in high potency. In 7 days, he was out of it. So this is the experience of antimony Ars. I like to call it as a homeopathic inhaler, homeopathic anti-asthmatic, homeopathic salbutamol. Remember this, excessive dyspnea. I've also used it in pleural effusion with good results. So this is the idea today about Antim Ars. It's a small remedy, but I call it as a lifesaver. You can write to me about your thoughts. Thank you.